Welcome once again to your daily transcription, your daily medical transcription, whatever the heck it is. Okay, so now we're going to start with a little x-ray. I love these little x-rays. I think little x-rays are a great way to start. Okay, so x-ray of the right foot, clinical history, injury, comparison, none, technique, 3 views of the right foot, findings. A small linear calcific density is present adjacent to the base of the 5th metatarsal bone. This may represent an avulsion fracture versus a non-fused apophysis. No other fractures are present. Impression. A small linear calcification adjacent to the base of the 5th metatarsal. This may represent an avulsion fracture versus a non-fused apophysis. End of report. Another X-ray. Portable single front of Little X-ray. Portable single frontal view of the chest. Indication, respiratory distress. Comparison, 7/27/11. Findings. There are mild increased ground glass opacities in bilateral lungs. These are mildly more prominent than on the previous study. There is no evidence of pleural effusion or pneumothorax. The osseous structures appear normal. End of report. Just can't get enough of those chest X-rays. Okay. Single frontal view of the chest. History, dyspnea, comparison. 2/24/10. Findings. There's a persistent nodular density in the left upper lobe which appears calcified, likely representing a calcified granuloma. Bibasilar atelectasis is noted. The cardiac silhouette is prominent. Impression. Persistent calcified nodule in the left apex. End of report. One more. Single frontal view of the chest. History. Change in mental status. Comparison. None. Findings. There is widening of the mediastinum. Some element of aortic ectasia is not excluded. The cardiac silhouette is prominent. No lobar consolidation or effusion is present. End of report. Okay, now for something a little more challenging, MRI of the brain. MRI of the brain without contrast. Indication, lupus. Comparison, none. Technique, T1 axial, flare axial, T2 axial, diffusion axial, and T1 sagittal images of the brain were obtained. Findings. The ventricles and sulci are unremarkable. There is no shift to the midline structures or mass effect. No areas of GRE susceptibility or diffusion restriction are present to suggest blood products or an acute infarct. The major intracranial flow voids are unremarkable. Evaluation of the contents of the orbits is unremarkable. Incidental note is made of leftward deviation of the nasal septum. Impression, unremarkable MRI of the brain. End of report.